Gaining resilience and bouncing back through acceptance and commitment therapy. ACT, apply to stuttering. As we all know, stuttering is not just speech disruptions. It's what's below the surface. The dread of speaking to strangers, that feeling like we're not good enough or we're less than human just because of how we talk. The overwhelming tidal wave of fear, anxiety, stress that has us frozen in that moment of stuttering. It's the social and interpersonal consequences and repeated traumas that we experience, from being laughed at, made fun of, mocked, talked down to. It's feeling like an imposter or putting on an act when we're just trying to survive a speaking situation, regardless of the techniques we're trying to use. It's everything else below the surface. Everyone experiences negativity and hardships throughout their lives, and those experiences are unique to the individual. But there are also shared experiences among the group. People who stutter are inherently very resilient. Every time you go out and talk to a stranger, you chance having a negative experience, and yet you carry on. That is what makes you resilient. Resilience is the process of adapting well in the face of adversity, trauma, or significant sources of stress. Everyone experiences negativity, stress, and sadness. As portrayed in the movie Inside Out, there's a reason for sadness. It lets others in to support us to carry on. Resilience programs have been applied to children who stutter in their families recently, and some of the common elements parallel very strongly with ACT are awareness, emotional regulation and impulse control, which includes acceptance, mindfulness, and cognitive thought diffusion principles of ACT. Implementing these allows us to increase our tolerance for dealing with negative emotions. We can identify our physical state of emotion to then make different decisions. Casual analysis is the ability to step back and think of the broader context, self as context, in ACT. Realistic optimism is gaining a stronger belief in those alternative stories or narratives. We don't have to believe what our mind is telling us. We can challenge it. Realistic optimism is also gaining empathy, compassion for ourselves and for others. And then the last element is self-efficacy. The belief that we can and will succeed at difficult things, as supported by our past experiences with success. Our confidence, vicarious experiences of watching others complete goals and objectives, and reaching out for support from others that tell us we can accomplish goals. Similarly, speech-language pathologists have more and more started to implement evidence-supported counseling-like approaches, such as ACT with people who stutter. The purpose of ACT is to increase psychological flexibility, tolerance of difficult emotions and thoughts, and strategies to consciously choose how we move forward. For example, acceptance. If we know we're stressed out, and we've taken time to sit with what stress physically feels like, we know that we're in our danger zone. We won't be able to let anything in. Then we can apply self-compassion and self-care to get us back to the comfort zone. One way that we can do this is through present moment awareness or mindfulness. If you're in a stressed state, breathe in through your nose and out through your mouth, and focus on what the airflow physically feels like in your throat and nose. That helps ground you to the moment. Another way of doing this is cognitive thought diffusion. I have the thought that I'm worthless because I stutter. Oh, thank you, mind. I notice that I'm having the thought. The more carrier phrases and ability you have to identify those reoccurring thoughts, the more you decrease your belief and fusion to those.
Context is another one of the ACT principles. It allows us to see that we are not the same as our thoughts, feelings, and experiences. We are the person who's experiencing them, but we're not the same as them. We stutter, but we are not the same as our stuttering. It's sort of like the sky. If we think about ourselves as the sky and our thoughts and feelings as the clouds, then we can see how the sky doesn't change despite the weather. Maybe you have a cloudy thought or a sunny, happy feeling, or maybe you have an upsetting reaction similar to a thunderstorm. The weather changes, but the sky doesn't. This perspective can allow us to differentiate ourselves from our experiences and our reactions, which can help us to be more resilient and get through those difficult moments. Values are the things in life that really matter to you. Maybe it's your job, your family, your friendships, etc. We also have personal character values. What kind of person do you want to be? Honest, authentic, kind, compassionate, funny, smart, etc. Think about your values and the ways in which you already live your life according to your values. Awesome. Now think about the ways that maybe you don't live according to your values. For example, if you value your career and your personal value is bravery, but you choose not to attend a networking event because you stutter, that might be where you are right now, and that's fine. But it might make you feel bad about that choice because it's not necessarily living according to your values. Similarly, if you value friendships and one of your personal values is authenticity, but you hide your stuttering from your friends, this might be okay and where you are in your journey, and that's fine. But it might make you feel bad because it might make you feel like you're not living according to things that matter to you, according to your values. The nice thing is we can change our choices so that we live according to our values. So it can be helpful for us to identify what matters to us and what our values are so we can make choices that align with those values. No one can tell you what's the right or wrong decision for how you interact with your stuttering and feel about it, what decisions you make for your communication. But if you are able to see what really matters to you, then you can make choices that make you feel good about your decisions. Now that we talked about how we can see thoughts, feelings, and experiences differently and interact with them in different ways, our next step is taking the action to achieve our goals and work towards improving ourselves. When you set goals, make sure they're reasonable and that you have lots of self-compassion embedded into them. Changing anything can be really difficult, especially when it comes to changing ourselves and our relationship with our stuttering. We all struggle sometimes. When you're riding a bike, you're going to fall off sometimes, and that's okay. We are on a journey, and no one gets to their destination without bumps and bruises. Congratulate yourself for trying and for as far as you've come, and dust yourself off and keep trying. You can do it. You are resilient.